do you think? Ready to roll?
Okay. All right. Is it on now?
I'm
Oh,
sure.
it's
It's been
going.
on. It's been on.
Okay.
So here we are again for the Ben and Gary Show. We know dentistry. It's a Friday. We're looking forward to being able to talk to you. It's the end of a long week, but we're still fresh to be able to talk to you. We've talked about a few things over in the past. This one is going to be coming from a patient's perspective here, with a question that we've gotten at our office. Probably our number one question that our receptionists have told us, our patient care coordinators have told us that patients call and ask about. And they want to know what goes into, the cost of a crown. And, we find that to be, we certainly want to be able to answer that question here. But I think the real question that an individual who is interested in quality over simply just cost needs to understand.
Right.
And that starts from the standpoint that a crown is not a commodity. It's a custom prosthetic device that's fabricated a one-off just for your mouth, for that one tooth. So a lot has to go into that in order to be able to make it feel comfortable, to be able to have it look natural, and to improve the quality of your dental life, so that it's not going to be something that you focus on, that it could just fade as if it's always been that way. So we want to start with that point, and talk about a few things that actually go into the fabrication of a crown. There are certain stages on actually being able to prepare a tooth, to drill on a tooth in order to have a crown fit in place, to drop in like a puzzle piece. And there's also the back side of it here, where they're usually fabricated in a laboratory and at a remote time here, so that you're going to have a second appointment where your temporary crown that you leave with is going to be then swapped out with the brand new final crown put to place. So with that said, that's just like not a commodity. A lot goes into that, because when you're starting it, what's the problem with the tooth in the first place can dictate on how you have to manage the final crown and what goes into that. Gary, we have got a few things.
Right. So how do you first assess the tooth?
Well, it's important to have a full exam.
Right.
It's important to understand what the patient is feeling. And it's also important to understand what was there in the first place. If it's a natural tooth that really only has very little done to it, and maybe they broke a portion of it, then it could be very straightforward. But if there's more to it, such as what's the source of the pain, it could be due to an irritation of their nerve or a problem with their nerve. It could be simply due to the fact that the portion that has been broken away is now causing sensitivity because of temperature, liquids, air are getting to the inner part of the tooth, which is just going to be generally more sensitive. And then, if it's a nerve problem, then we also have to address that as well, because it's not simply just a structural issue. It's a biologic issue of the nerve that it can't seem to, it's almost like it's malfunctioning or short-circuiting and giving you odd sensations that you can't really control or are not normal. Right. And so sometimes that can be due to the fact that the outer structure of the tooth has an issue where part of it's cleaved off. It could be due to the fact that the tooth may have a fracture line that propagates through the whole tooth that gives it sensitivity. It could be a decay issue that is now irritated a nerve. Now, whether or not that nerve is going to become normalized once we put the crown in place, or the temporary crown, sometimes remains to be seen. But then sometimes we also know from just looking at the radiograph or X-rays that we also have to have taken in addition to the examination. So that we're able to see the whole picture, meaning we can only see visually from the outside, but we can't see inside or in between the teeth. And that's why we have to take X-rays and look at it from multiple angles to give us our full assessment. And even then, we may not really actually know until we start actually working on the tooth. And as we begin to prepare it, means grind on it there to make it smaller, so that a crown can slide down over top of that to be able to create it in the same exact shape without it being too bulky or too odd in your mouth. We have to grind on that to be able to make it smaller in order to do it. Think of it as a thimble kind of sliding down your thumb. How do we make that fit into place so that it's seamless on your tooth? We don't want to make it too bulky. So we have to do things like that. And so the assessment of that really kind of sometimes can grow as we move through it.
Right. So there's many facets to this whole process. I mean, as far as assessing what is going on with the tooth, whether it's decay or nerve issues or fractures, but we also have to look at how much tooth structure is left after we have removed the decay. I mean, do we have enough tooth to actually...
Too short? Is it
Yeah.
too short to be able to hold a crown? Think of that thimble.
Right.
If you only put it on the tip of your thumb, it's easy for it to slide off, versus if it's much longer, sliding down a larger area, it's going to be more secure.
Right.
If it's a short tooth, the same concept here, it's not going to stay on that well. And we have to make a decision, because what we're looking for is longevity. And what goes into that quality is not simply just doing the procedure and letting you walk out the door with something that's going to be there and God only knows how long. Our goal is to... listen, dental issues are what I've been told are chronic. That's going to come back to you at some point in time. So how far can we push that out? Further down the road, theoretically, how far can we kick the can down the highway before we see it again? Right. And the idea is that we want to kick it as far as we possibly can. So a full assessment on not only can we do the crown here, but then how much longer do we anticipate it actually being there? Which means, is it going to have a good prognosis for a long period of time where you don't have issues? And that's what we're shooting for. That's what we want for our mouths. That's what we want for our patients. Of course, that's what we want for our relatives. So we're going to treat you in the same kind of way. That's the philosophy that we have. And I think that if you want quality and longevity, that's how you have to assess it. And that doesn't happen quickly. Sometimes people really want to just get in and out. And I understand dental appointments are not something that are top priorities on favorites, where you want to go visit. So you naturally want to get in and get out.
But
that can be a problem.
Fast is not necessarily good.
Yeah.
And quick is not necessarily good. But we have the ability to schedule our patients so that we have time to spend to assess everything properly, and we basically just have that, I don't want to call it a luxury, but we have the ability to not have to compromise what our treatment plan is for you.
Basically, if you don't want to have compromised dentistry and have to see this sooner down the road than you want to, then taking your time in advance to make sure that there is going to be enough time to be able to diagnose it properly, to do it properly, and ultimately simply just do it right.
Right. So everything takes time. To do it right does take time, and people sometimes don't want to have the time taken. But
we get it.
That's what we do. We do things right. So.
People come with. We talked one of our recent discussions we had talking about the fearful patient. In order to do it properly, sometimes you have to overcome patients' fears that are there. So if you don't have time, if you only have the typical practice where they've scheduled an hour and you have to get through the fears and get through the work and do it right and get them out quickly, I don't know what kind of product I certainly don't think I could actually do that. I would need to schedule enough time to be able to make sure that it is done right and that we're not traumatizing an individual while we're doing this. And I think, honestly, that's just goes to one of our core values that we have, to treat patients as we want to be treated. It's one of the things that we say in the morning every day amongst all of our team members, is that's the mindset that we want to have. And I think that's honestly, if quality-driven, quality results, you have to think of it as treat the patients as you would treat your own family or yourself. So there's lots of things that go into it. We haven't even scratched the surface on perhaps if it's not just a crown, maybe there's an old filling that's in the tooth. And if you want to cut corners and do it quickly, sometimes you don't take that, docs don't take that filling out, and you put a crown over top of it. Essentially, you could potentially be putting a cork on a problem.
Right.
And, and thinking it's going to be okay, when in reality it could be smoldering problem.
Right. So let me just explain what Ben just is talking about here, is that when patients come in for their 6-month cleaning and we take x-rays, if you have a crown in place, you cannot see what's underneath that crown. So therefore, if we kind of backtrack here, before you put the crown on, we want to make sure that there is no decay on that tooth or on that tooth before we place the crown. So a lot of times with the old fillings, there can be decay underneath. We take the time to take that off and make sure there's no decay. Then we rebuild the tooth, prepare it properly, take the impressions, and so when the crown comes back, we know that we're putting it onto a surface,
solid foundation,
or a preparation where a solid foundation is exactly right. And so when we cement that crown, we have the ability to know that we can sleep at night because we've done things properly. So,
yeah,
right,
yeah, absolutely, well done.
But we've talked about this in the past, is that we also have our lab on site, so we have full control over the quality and the types of materials that we think are best for your crown. And so we select all that. We have our ceramics that can take the proper shade and customize the tooth so that it looks natural,
It blends.
blends, and functions properly.
And that's one of the other advantages of what things that we do in terms of aesthetics. You know, one of our passions is what happens in the front of your mouth, and that can be a real challenge if you're trying to match one or two teeth to the rest of the other teeth that are there. That's a real art. That's a real challenge for us. And when you have a laboratory that is off premise, where you have to send it, put it in a box, send it FedEx or however you need to send it, that same individual on the other end doesn't necessarily have the same advantage that you have of seeing under the same light, seeing that patient, seeing all the personality that's along with it, so that you can actually dial that in, the color, so it blends into that individual. Having all of that technology and that lab support on the premise where the patient can meet actually our technicians to be able to help fabricate it, we have a far better chance of being able to deliver the first time, being able to have it blend in. And even if at that same appointment it's not quite right, well, that's another advantage. We don't have to put it back in a box, put your temporary back on, and send you off and have you come back another day. It's simply take a few minutes and take it to the lab, make the changes that we need to, same day, deliver that wonderful crown that has been tweaked just right.
That was nice.
It is nice. It's a sort of dental Shangri-La.
Yeah. So you met Rick Bishop, our ceramist, on another show, and so he's our ceramist that does a beautiful job just for you.
Exactly. So I think that at least it touches on a few important subjects about how do we determine, how do we actually determine why we charge what we charge, or what individuals, what goes into fabricating a crown. And there's a lot that goes into it that you may not be aware of. And if you want quality, sometimes quality takes some time, and it does take a little bit of custom treatment. And when somebody's invading your personal space, like we do very often, you want somebody who you can trust and have the understanding of what their mindset is. And I think if you're quality oriented, these are the things that you need to be thinking about when it comes to a crown.
Well said.
So I hope this gives you a little bit of understanding about what goes into the fabrication of a crown and where the costs come from. And this is just another time for the Ben and Gary Show to be able to share a little bit about dentistry and things that we know a lot about. Thanks a lot. See you next time.